Hi, and welcome back to the Natania G podcast. I'm really excited about our guest today, Dr. Adili Rikondja. She is a physical therapist from Los Angeles, California. She has a doctorate in physical therapy from the University of Southern California, and she has clinical experience in outpatient neurologic and orthopedic settings, as well as concierge physical therapy, rehabilitating clients in the comfort of their homes. Currently, she is a clinician at Playa Physical Therapy, where we have connected, and excited to have you here.
I'm very excited to be here.
Yeah.
Yes, I love working with you, and I'm happy to be a part of your podcast
Yeah.
today.
When you first came on board to apply physical therapy, I remember one of the first times I was introduced to you. You were over there in the corner. You had music going on. You were clapping your hands. You had all these fun cones on the floor. And I was
Yeah.
like, yeah, that's it. That's what we should be
I
doing.
try to keep it fun, yeah.
Yeah.
Yeah,
Physical therapy should be fun. I hear from a lot of
absolutely.
people sometimes it can get really boring, but
Mhm.
there's a rhyme to that reason when people
Yes.
see
Yes,
see
yes,
the simple
yes.
exercises, which we'll get into.
Yes,
Um,
absolutely.
but I wanted to get right into it
Yes,
because I
ma'am.
deal with a lot of clients that have seen physical therapists, are seeing physical therapists,
Mhm.
possibly can go to a physical therapist.
Mhm.
And I just wanted to be able to bring all this information out to show people how it can really help you and support your wellness program.
Yes.
So, to take a backtrack for those people that are not familiar
Mhm.
with the educational background that is required for a physical therapist,
Mhm.
talk to me about your educational background and your journey. And then, what inspired you to become a physical therapist?
Absolutely. That's a great first question. Okay, so first I'll start with what inspired me to become a PT. So when I was in high school, I had an injury, and that ultimately led me to get surgery and then go through the rehab process. So that's the basic answer. And I feel like if you ask physical therapists that's what they'll say. Like most of the people have had something that has personally impacted their life and has led to this positive transformation, thus leading people to want to help others. So that's basically my story. But if we backtrack it a little bit more,
Yeah.
I knew that I always wanted to be involved in healthcare in some way. I didn't know in what realm. So I was thinking maybe dentist, pediatrician. I wasn't really sure. So when that high school injury happened and I found myself in the physical therapy clinic, I had a very difficult process.
Hmm.
So I had a lot of pain. I was recovering from a major surgery. And at the time, I was a volleyball athlete that was getting recruited by numerous universities. At that time, a couple of those universities rescinded their offer, and I got in a place where I was really discouraged. I wasn't really sure about my future, and I was a first generation college student. Thank goodness I ultimately went to college and everything, but
Yeah.
just having that in the back of my head, there was a lot of pressure in terms of me keeping myself healthy so that I can get a scholarship. That was the ultimate goal. So I had this outstanding physical therapist who really helped me understand that I could do it, and they put that into my head early on. And then me being in that physical therapy setting, working with multiple therapists, looking around, I was saying, I can do this. And I really admired their work ethic and the sense of community that they had. I was at Kaiser in West
Mm.
LA. So shout out to them to get me started on their journey. Then I did an internship there the next year. And then I knew for sure that that's the career that I wanted to pursue. So, yeah.
It's incredible how people can inspire you and support you, and then you want to just give back.
Yeah,
Yeah.
absolutely. So, education.
Yes.
Okay, so circling back,
Talk
circle
to me
back.
about this.
So, education. So, it takes quite a bit to actually obtain your physical therapy degree. Typically, people do 4 years of undergrad, and I say typically because it doesn't need to be consecutive 4 years, but you need an undergraduate degree in kinesiology, biology, chemistry. Mine was in psychology. It does not matter as long as you fulfill those physical therapy prerequisites.
What are some physical therapy prereqs like
Ooh, chemistry.
for physical therapy?
Yes, for
Okay. So
physical
all the
therapy,
sciences
all
or
the sciences, chemistry, physics, biology, statistics, psychology. It's a lot. So, and you don't have to major in the sciences in order to be a physical therapist. I have some classmates that were journalism majors before they actually became physical therapists, but you need to take those prereqs in order to go to PT school.
Really well-rounded.
Yeah, totally,
Yeah.
totally. And I think that that speaks volumes to the well-roundedness of our profession, because if all of us just majored in one thing, we wouldn't have all these different perspectives that is required in order to treat the whole person. So after you get your 4-year degree, then you go to physical therapy school. But in order to get to physical therapy school, there are observation hours, letters of recommendation, there are there's the actual application for one. And then once you get into physical therapy school, you complete 3 years of coursework, both didactic and clinical rotations. And then after that, you can work. Most people go straight into the field, how I did, and then others do residency and fellowship to further their education in a specific like population.
And is that where you receive your doctorate?
At USC, yes.
Okay.
Mhm,
So after
mhm.
the 3 years, do you take, like, an exam? Is there
Yes, the
Okay.
board. How can I forget the boards? That's funny because it was such a big part of my life. So
Yeah.
yes, there is the boards exam. So that is going to certify you nationally to practice. So that exam is very important because it's how you get licensed and it's how you get the green light to be an official physical therapist. Yeah.
Wow.
Hmm.
So there's a lot of requirements and education that go into
Yeah.
before you can come out and call yourself, "Hey, I'm a physical therapist."
Yes, and I think that's what some people don't understand,
Correct.
because and there are reasons, and I'm sure we're gonna get into, with this interview, but yeah, a lot of people don't understand that. So I have some clients that come into me right now because I am in that outpatient orthopedic setting, and they'll ask me for a massage, or they'll, may compare me to someone else who is more like manual based, and I'm not a massage therapist, so I think
No.
that I think that some people get that kind of confused, but we could do better as, physical therapy as educating to educate our patients. Yeah,
Yes.
yeah,
I think that's really important and something that I did wanna highlight,
yeah.
because throughout my career, I've worked with many clients, because my background is in personal training.
Mhm,
And when people would come in with an injury, sometimes they would seek out the help of a personal trainer for
mhm,
lower back pain or knee pain or things like that.
mm,
And, my initial training was through a doctor of physical therapy, Dr. Mike Clark,
mm,
through the National Academy of Sports Medicine when I worked with them.
mhm.
So I was familiar with the assessment, the goniometric, like we
Yes.
discussed, but I always knew my side of the fence,
Mhm,
whenever it came to pain. Like there's certain things you can do for, corrective exercise.
for
But
sure.
the thing I wanted to highlight, just to take a little tangent, was, if I'm somebody that's working out and I'm continuing to experience this lower back pain or some
Mhm.
nagging issues, when should a physical therapist come in?
Yeah, that's a
And
good
should I go to a
question.
personal trainer first, or should I go to YouTube first, or should I,
Right.
you know, when does the physical therapist, come in as the doctor to really guide me,
Mhm,
to knowing what's going on and how I can help myself versus going to a personal trainer, not saying that they can't help,
mhm.
or even a certified rolfer or a
Yeah,
massage therapist,
right.
because there's a difference.
Yeah, yeah, there is, and I think that with all those disciplines that you just mentioned, all those different routes, someone who is very passionate about getting their clients or patients better, there will be some overlap, right?
Yeah, of
So
course.
there are going to be some natural overlap, but I would say with your question of if someone is having back pain, who is the first person they go to? Come to a PT. This is what we are trained for. We do a full body examination, multi systems examination, figure out where the problem is coming from, identify areas of weakness in your body, as well as range of motion limitations, everything, even looking at your breathing patterns. Hopefully, everyone is doing this just to figure out where the issue is stemming from and to hypothesize. We also don't always have a concrete answer, specifically with low back pain. It's very multifactorial. Lifestyle can be a big factor in low back pain, and it doesn't help when people are sitting for long periods of time. Our bodies aren't really built for that. So I would recommend that someone comes to a physical therapist first, and if need be, go to their primary physician to get a referral or things of that nature. But come to us first because we are the movement specialist in terms of looking at your low back and the surrounding areas and really examining. Yeah.
Absolutely.
Yeah.
And I remember once talking in the office about this. Why it's also important is it might be something more than musculoskeletal,
Yes.
right?
Yes. Oh my
And that's
goodness.
something that a
Yeah.
physical therapist can kind
Can
of be
rule in or out.
correct.
Absolutely.
So can you give
Yes.
me an example of
Oh,
that?
yes,
Okay.
absolutely. So I actually had this woman who came to me in the clinic for low back pain, and she was having this just diffuse low back pain that didn't really change with position. Her back pain wasn't being reproduced with any palpation or any joint mobilization assessment or anything like that. And it was persistent and it was getting worse.
Yeah.
And she also has this autoimmune condition. So I did my evaluation. I looked at her vitals, her movement, everything that I could. And I ultimately said, I think that we should get you a referral to your primary physician. I didn't think that it was an emergent referral, but definitely more urgent. So to get her symptoms checked out, and it turns out she had a UTI. She got put on the medication for it, and then she came back to me, and we were able to not fix, we were able to address some of those underlying conditions and issues that she had. But her back pain was gone after like a couple of
Mm.
weeks. So had she not come to me, had she gone to someone else and they're telling her to strengthen her core, fix her movement patterns, or, they might not be able to identify those classic signs of UTI, which I had kind of
UTI
hypothesized she
is
had
urinary.
urinary tract infection.
Okay,
Yeah.
just for everybody
Yeah,
to.
absolutely.
Yeah.
So yeah, that's ultimately what was going on.
Yeah.
Yeah.
Have you had other instances like that, or was that like the main one? Because I know sometimes in a
Yeah.
joint, like also it could be a cyst, it can be something, a growth, it could be
Yes.
like,
Yes, I have. I've had this pediatric patient also with knee pain, and something just wasn't kind of sitting right with her presentation. And she ultimately got referred to an oncologist, and everything ended up being okay. It was a benign tumor. But yeah, there's instances like that.
yeah.
She couldn't walk, like weight bear, walking into the clinic limping. So when I start to see things like that and it's not matching up to why she came to me initially, that's what makes me kind of curious and warrants referral.
Yeah,
Mhm.
that's a really distinguishing difference between seeing a
Yeah.
doctor of physical therapy versus, if something's not going away, physical therapists really have the ability to be like, this is not adding up.
Yes.
This is let's look a little bit further into this
Yes.
versus trying
Mhm.
different movements it's
Mhm.
like this doesn't add up. So I think that
Yeah.
that's really important to highlight and
Mhm.
when somebody should probably when they're continuing to experience this discomfort, they've
Mhm.
tried a couple of things like, make sure you're
Mhm.
checking in with your physical therapist
Yeah.
to just catch maybe there is something that,
Mhm.
we need to take a couple more tests or go a little bit
Yeah,
further.
absolutely. And you make me think this conversation is great, by the way. And
Yeah.
it's making me think about just other people that I've worked with. And
Mhm.
sometimes it's not them, but it's their family members. So they'll mention something to me casually. My wife, she's a breast cancer survivor and she's been having this back pain. It's not going away. And in my brain, I'm thinking like, let's have her maybe come see me or get evaluated by someone else to make sure that it's not any metastases, especially when someone hasn't fully been cleared or isn't in full, remission. So those are the things that we are trained to look at, especially at USC. Anybody who went to USC, any of my fellow Trojans out there, you know that we are drilled on everything red flags, yellow flags, things that warrant emergent referral, urgent referral. So that's something that the program does a really good job at in terms of making sure we have an understanding of looking at the patient that's in front of you, identifying if they need to go and get seen by someone else, and making that happen quickly. So,
Yeah.
yeah.
The other thing I want to highlight that I believe makes you unique and Playa Physical Therapy
Hmm.
is um, I've had clients come into me or friends and
Hmm.
oh, physical therapy, all they did was just give me some movements and I
Yeah.
just took them and I'm going to just do them at home. They just give you
Hmm.
some exercises or sometimes people are like they didn't do much. I thought they were going to do more tissue work and they just
Right.
didn't do too much like
Hmm.
tissue work. Or they're like, oh, they're giving me really basic exercises. And I try to explain to people, I mean, this is from my perspective, and I'd love to talk to you a little
Yeah.
bit more about this is, when you go to a physical therapist and they're giving you these exercises, they're giving it to you, for a particular reason because your
Mhm.
movement pattern is not quite where it can be or should be. There's
Right.
possibilities for you to move better. And
Absolutely.
that, in essence, hopefully decreasing the pain or discomfort that you're having.
Mhm.
And having somebody really watch you, because sometimes it's in the nuance, right,
Mhm.
of their exercise,
Yeah.
like how they're moving, how
Mhm.
they're hinging,
Mhm.
their patterns. And, being able to have somebody really give you the right cue to get your nervous
Yes.
system linked in
Absolutely.
is
Yeah.
so important. So while it might be a repetitive motion at first, or like
Mhm.
a bridge or something like
Mhm.
that, just hang in there.
Mhm.
They're doing that for a reason. Because if
Yeah.
you're just going to take those exercises and be like, oh, I know what I'm doing.
Mhm.
I'm going to take them home and I'm going to do them myself. I know how to work out.
Yeah.
It's not the purpose. We
Right.
know you know how to move,
Right. Exactly.
but are
Yeah.
you moving the way
Optimally. Yeah.
correct? Yeah.
Yeah.
So, and then they're like, oh, physical therapy doesn't work.
Yeah. Yeah, I have a lot of thoughts on this whole question or
Correct.
comment, but I wanna make sure you were finished. Yeah.
Yes.
Okay,
Go
okay.
for it.
So, a lot of times when patients come in, I see people who they say, "I've gone to this place or this place, and, oh, the PT saw me for 5 minutes,
Yeah.
10 minutes," right? A lot of times I'm on the patient side, but I'm also on the physical therapist side because the direction that our profession is heading in terms of insurance, kind of cutting the reimbursement rates for PT. So, what that means is if, let's say, okay, I don't want to get into it too much, but
Okay.
basically, a lot of PTs are no longer being paid their worth. So you go through 3 years of undergrad, 3 years of grad school, and then, undergrad, you go and do Con Ed, right? And a lot of times the people in the profession aren't getting paid to what they believe their worth is, like salary rise, right? So, and a lot of times that's because insurance isn't necessarily paying the PT their worth. Again, I don't want to get too much
Mhm.
into this, but what ends up happening is PT clinics say, okay, what can I do to supplement to make sure that our PTs are getting paid and that business is still flowing? They say, okay, well then let's see 2 and 3 people in an hour, right? So that can really be at a detriment for the patient because you're no longer getting that specialized attention that you need. And trust me, a lot of PTs, a lot of outpatient PTs that are in this situation don't necessarily like doing this, but they're trying their best. And then you have a lot of different types of PTs if they work in that setting where you're seeing 3 people in an hour where they will try their best, but it's the it's the system that's not working to their favor. So I say to the patients that are in a situation like that where you can either A, see your PT is trying really hard to get you better, but something is not working for you. You're doing the same movements over and over, no progressive overload, no changes, no specialized attention, or B, the PT is not giving you that attention. They're not really trying. Either way, leave and try to go somewhere else to where you feel like you're getting that appropriate attention because there are so many outpatient PT clinics out there. There are people that come to your homes now. There's concierge PT, all of these different clinics and different businesses that can help you and get you the care that you need that take insurance, but it does take some time to kind of find those. And then to the patient who feels like they're not getting better, you know, advocate for yourself. Have that conversation with your PT. And I've seen these kind of conversations go a lot of different ways where sometimes it is the PT's, I'm not gonna say fault, but, where they're not really putting that attention into their patient for multiple reasons. A lot of the times it's not intentional. Burnout is real and
It's
it's
like that
not
in a lot of
Yeah,
professions. Yeah. There are
exactly.
some really good ones and there are some
Yeah.
ones that could possibly do better.
Yeah, exactly.
I'll leave it
And
at
that
that.
yeah, and that's
Yeah.
okay, right? But the main thing is if a situation is not working for you, you have to be your own advocate and try to seek what you deserve, what you feel as though you deserve elsewhere. So,
What would
yeah.
be some questions you would tell um, individuals to ask when they call a physical therapy clinic? Like, what should they ask to make
Mhm.
sure that it meets certain
Yeah.
standards that
Yeah.
would be best?
And again, everyone has different standards, right?
Mhm.
So for some people that they might not need that one-on-one individualized care. They know what they need to do and they're okay with not having that attention. But for those who want that attention and for those who are seeking that experience, the number one question, sorry, would be how long are my visits and are they one-on-one with the PT? Those are the main ones. And you can also have an evaluation with a physical therapist. I've had someone, I've had someone, this is a client that I ended up working with and discharging, but in his evaluation, he told me that I've been to two other evaluations in the area and I'm trying to find the right fit. And I was like, wow, that is really admirable to me as long as insurance will take care of it because you're finding the right fit for you. So in that, evaluation, he was asking me questions. What is your approach to treatment? How can I know that I'm getting better? So those questions.
Really smart.
Yeah.
Yeah, really
Mhm.
smart.
Mhm.
All right. Well, let's get a little bit into your background because I know you worked at a physical therapy clinic that focused on the nervous system and neurodegenerative diseases. Can you
Yes.
share more about that experience and how it's
Yes.
shaped your approach? Because I think you brought a lot of that to your
Mhm.
current
The practice.
practice. Yeah.
Yeah, absolutely. So I worked at a clinic called Reactive Physical Therapy and Wellness, owned by the wonderful Dr. Julie Hirschberg, and she was my professor at USC. She taught neurology there, and in clinical practice as well as neuroanatomy. So that was her contribution to USC students. So even before that, I volunteered in a clinic a bunch of times, and I made a lot of connections with the um, the staff there as well as the patients. So we worked with people who had neurodegenerative conditions as well as just dysregulation of the nervous system, so nervous system issues as well. And there I really learned the importance of interdisciplinary care. So that's something that I definitely want to continue
Can
with
you
my
explain that?
practice.
Like, what would be an
Yes.
example of some of
Yeah.
the cases you would deal
Mhm.
with, and what do you mean by
Disciplinary
interdisciplinary?
care.
Yeah.
Yeah. So that means when a patient comes in, they are being seen by a physical therapist, an occupational therapist, a yoga therapist, a psychologist. There's other things. Sorry if I'm missing
That's like
anything,
my
but
dream clinic.
I know, I know.
Yeah.
So a lot of the time, um, well, the reactors model, they have programs. So people come in for a set amount of time and but most of the time they're cash based or they're Medicare. So they don't take like private insurances or anything like that. And I think that that model is really where the future of physical therapy, in my opinion, kind of should be headed toward. My only hesitation would be making sure that everyone can really afford those services. And they do have some outstanding financial aid options for those who don't have X amount of money right off the gate. So, yes, but it's outstanding. So each person gets a team of individuals, and then there are interdisciplinary meetings, so 30-minute meetings for one person each week where we would talk about their case and talk about what went well in the week, what can be improved in the week, and then also we would communicate with their physicians or people in their community, so their caregivers, family, things like that.
I mean, that just hits it
I
right on the
know.
head
I know.
for how to
Yeah.
help a whole person, you
Yeah,
know? What
absolutely.
would be some examples of cases you would have?
Ooh, okay. We worked with a lot of people with functional neurologic disorder,
Mhm.
chronic pain. There were some folks with Parkinson's disease, multiple sclerosis. So it just really depends. But the vast majority of clients, patients that I saw at Reactive had some form of chronic pain, functional neurologic disorder.
Okay.
Yeah,
What's an
yeah.
example of a functional neurologic disorder?
Yeah,
Just for
okay.
everybody to,
So,
yeah.
yes. So a lot of people don't know about F&D. So F&D is essentially where your nervous system is dysregulated to the point where you have physical manifestations in the body. So the nervous system is complex, and basically it has a lot of different, components. But when the signals aren't being transmitted correctly, there can cause dysregulation in the body, and that can lead to anything to pain, tremors. It's just a wide range of symptoms. But at reactive, we would really treat the nervous system and getting the body more regulated, as opposed to treating the actual symptoms. In fact, we didn't want to even talk about the symptoms as much, because that would lead to the patient becoming more internally focused and focusing on their symptoms as to what's going on, instead of how we can help, and build their neuroplasticity. So your body's ability um, to retrain your brain.
Right.
Yeah.
What are some examples of things you would do
Oh,
to help
yes.
regulate the nervous
Yeah,
system?
and this is something that I learned at Reactive. It's still something that I do in my practice now. So, I'll talk about a patient that I had recently, a couple of weeks ago. So this person is a mom, and she has been experiencing a lot of stress, lately. She also has had a lot of trauma in her life, and she came in and she said that she's seen me for back pain, by the way, and her back pain has been getting better. But on that particular day, it was, really extreme, and I noticed that she was really focused on it and really concerned, thinking that she slipped a disc again, and I had to really take the attention away from her low back. So I say, "Ma'am, what's your favorite music? What do you wanna listen to?" The whole time we talked about things that were joyful, that brought her joy, and I noticed that she was essentially not thinking about it anymore. And this is not to say that she wasn't in pain, because she was,
Mhm.
right? So that's something that people, I almost said something there, but some medical providers don't understand that people that have chronic pain are in pain. It is real. It's not something that's being made up or anything, right? So, when I was working with her, we also did some diaphragmatic breathing, and when she's breathing, I had her, like, breathe into a straw and, like, move a balloon instead of taking deep breaths. That's something I learned at Reactive. So,
Mm.
putting together a lot of external focus, into your practice. So, instead of saying, "Take a deep breath," you know, do something else that's more fun to regulate the nervous system. And then at the end of the session, I didn't even ask her, "How do you feel?" But she said, "Hey, I feel better. Like, I don't know what you did, but it's not hurting as much. I'm not thinking about it as much." So I explained to her, kind of what potentially could be going on in terms of her nervous system being dysregulated, and we identified certain tools that I think could be beneficial with her.
That's incredible. I mean,
Yeah.
that's what I've seen when you're working with clients. It's not just to like hone in on
Yeah.
where the pain is, because
Mhm.
sometimes it's not where you think it is. And it's
Right.
absolutely sometimes the nervous system.
Yeah, and
Um,
then yeah.
and I love that approach. I love
Yeah.
the diaphragmatic breathing.
Mhm.
That's session one in
Yes,
Rolfing,
yes. Oh,
is
yes,
making
that's
sure
true.
somebody can, take a full breath in,
Mhm.
out, and
Mhm.
we bring it to that and their
Mhm.
awareness of that. So it's
Yeah.
really, it's helpful after the
Mhm.
first session.
Mhm.
I don't ask them, how do you feel either? They're
Yeah.
just like, feel more open. I
Mhm.
feel like it's gone, like, and it's like,
Exactly.
so
Yeah.
I love hearing that. One of the
Yeah.
many reasons why I refer all my clients to you if they need a physical therapist.
Yeah.
Um, for those unfamiliar, can you explain what physical therapy is and how it might differ from other health professions such as chiropractic care and massage therapy? Because I do, just a follow up to that, to run on a tangent, I sometimes, like I mentioned prior, have clients come into me and be like, I've been to a physical therapist.
Mhm.
They did absolutely no tissue care. All they did was
Mhm.
just movement. They did
Mhm.
something a little bit here and Or I get clients that are like, oh, I went to a chiropractor and they did these basic adjustments. And,
Mhm.
sometimes you can work with a really great chiropractor that has a really great approach and it
Absolutely.
works. Same thing with, physical therapy.
Mhm.
So how does physical therapy differ from, let's just use chiropractic and massage therapy?
Yes. So, great question. And physical therapy, something that people have to realize or learn is that it's very broad. Okay. So, you have inpatient, outpatient physical therapy, home, PT. So, in the realm of outpatient physical therapy, that's where you're going into a setting and you are not in a hospital, you're not in a facility, but you're going into a setting and getting that care. So, I'm going to compare specifically outpatient physical therapy with chiropractic and massage therapy. So, I actually took notes on this because I wanted to get it correct. But physical therapy is more so to improve the quality of life through optimizing physical function. Okay. And then that can be addressed first through a thorough evaluation. The evaluation is important to rule in or out certain diagnoses or to rule out the red flags that we talked about earlier. So that evaluation is important. And then examination of multiple body systems through incorporating different interventions from neuromuscular retraining, manual therapy, exercises, things like that. I've shadowed chiropractors before, and I know some outstanding
Me too.
chiropractors, yes. And so from my observations, they focus more on the musculoskeletal system as opposed to all the other systems. That's their primary focus. And they focus a lot on the spine and pelvis through manipulation, soft tissue mobilizations. When I was shadowing some chiropractors at my previous rotation, AIM Sports Medicine, another great place in Hermosa Beach, um, they really know their anatomy. Like, I learned a lot about, how to move and manipulate the body to, like, release tension and, yeah, they're just outstanding. So, it depends on your preference if you want more like a manipulative practice for a chiropractor where they do more manipulations or soft tissue and stretching. And then massage therapy, I haven't directly shadowed any massage therapy therapist, but they seem to do more like soft tissue work to address physical limitations. So in reality, there could be overlap, but the issue that I see the most in my practice is when a physical therapist does 50 minutes of soft tissue over and over again. And they might do a couple of minutes of stretching at the end of their session. And then the patient may or may not get better, but then they come see me for a second round of PT. And there may have been months or years in between, and they're expecting me to do the same. Heavy manual therapy, heavy massaging, and that's not my approach. That's not what the research shows that in terms of physical therapy best supports your patient
What is the research showing?
that you need to create soft tissue change in order to improve range of motion, flexibility, but then to follow up with exercise because that is going to have that long-term benefit and change that you want to see. And not just follow up with exercise, do a stretch here and there, but follow up with utilizing that range of motion that you gained into functional movement. So for instance, if this has actually just recently happened, I noticed someone was walking and dragging their left leg. They really weren't lifting up their left leg while walking, and their hip was kind of shifted to one side. And they also weren't getting full extension when they were walking. So when they're walking, one side was being dragged because their hip was so tight, and for a lack of more scientific terms. So I worked with their hip flexor and I released their hip flexor. That only took maybe 6 minutes. So very short in the beginning, manual. And then I followed up with some passive range of motion into extension. So getting them that hip extension. I'm sorry to anybody who doesn't understand what I'm saying. I'm kind of nerding out right now.
Well, the psoas is a
Yeah.
muscle. Just
Yes.
to go over it for those
Yeah.
listening,
Yeah.
it actually originates from the front of the
Mhm.
lumbar spine, comes
Mhm.
down,
Mhm.
passes kind of like anterior
Yep.
medial through the hip and comes
Mhm.
down to and attaches to the back top of the leg, the lesser
Yes.
trochanter.
Mhm.
And it's what brings your leg up. So as you're
Mhm.
walking, when you're swinging your leg forward, that's hip flexion.
Mhm.
When you swing your leg back, that's hip extension.
Yes, ma'am.
Okay.
All right, this is why we have you leading the anatomy. She's great. Okay.
That's how I
That's
learned. I
how
was
she
like, let me
learned.
make it really, really
Break it
simple.
down. Okay,
Yeah.
okay. So basically I worked with their hip flexor and I took them into more passive range of motion. Then I had them doing just that step over. We worked on the gait mechanics. We worked on it. Then I had them doing other movements on the floor, taking them into more hip extension. Then we strengthened the hip flexors because they're weak. So the reason why they're not using it is because there is a muscle imbalance there. So that's a really comprehensive approach. And also during that time, because I try not to be so internally focused while I'm doing all this, I'm not explaining to them really what's going on. We're talking about other things, having small talk. And then at the end of the session, I say, okay, this is what we're going to do next. We're going to work on going upstairs. And, I'm trying to kind of tie it all together without focusing too much on their hip because people can get really into their heads in terms of thinking something is wrong with their body. And just because you have muscle imbalances or you're not moving correctly doesn't mean that something is wrong or that anything is dangerous. So,
Yeah, I say that. I
yeah.
mean, our body is not symmetrical.
Yeah.
Differences left to right.
Mhm.
We're all going to have imbalances. I like to,
Yes.
there's a quote I once heard. I like to tell my clients, your current alignment and
Mhm.
movement patterns, that's just an outward expression of your life
Yeah.
story.
Yes.
The
Yes.
injuries you've had,
Mhm.
jobs, sports, repetitive
Yeah.
movements, that's your life story. And
Mhm.
sometimes it's not working for you anymore. So,
Exactly. And then this made me think about something else in terms of imaging, specifically for the hips and the low back. There's a lot of fear around imaging and MRIs, and people don't really have a lot of understanding as to, hey, I'm having these symptoms. That doesn't mean that something is wrong with my body. And just because you have changes in your MRI doesn't mean that it's dangerous. So I wanted to also make that clarification that I think that a lot of PTs, when you're treating someone for low back pain or in that initial evaluation, there needs to be a conversation surrounding imaging and kind of making sure that people understand what you see on the MRI doesn't always correlate to why you're having pain. And that's very important because every week, if I have a low back evaluation, that's the first thing that people are saying, you know? Yeah.
what are the most common injuries or conditions that you see?
Low back pain.
Low back pain. I know, me too.
Yeah. Yeah. Low back
Yeah.
pain for sure. In this setting. Definitely right now, a lot of low back pain. That's the number one.
Are there specific patterns or habits that you notice in people's daily lives that contribute to these injuries, and what can they do?
Mhm.
If they're not experiencing it now,
Yes,
good for
yes.
you. But what can
Yeah.
they do to make sure that their patterns or daily activities don't
Mhm.
lead to it?
I think the pandemic has really shifted work into the virtual realm, which is great for people who can work from home and who can really, you know, have more flexibility. But it doesn't lead to flexibility in your body. So a lot of times people are sitting at a desk for a long time, and that's not really good for your back. So in terms of things to do, stand every hour if you're not doing that already, and try to incorporate some type of flexibility practice, whether that's yoga or YouTube has mobility videos, but try to get your body moving and try to get your steps in throughout the day. And I know it's easier said than done, but that's a good way to start. Yeah.
Yeah. I anything for the nervous system. I know there's a
Oh,
lot out there like people very
yes.
fovea focused, meaning they're
Yes.
really like zoned in on their computer and how
Yes,
that can affect.
absolutely.
Is there
Yeah.
any suggestions you have?
Yeah.
Because it doesn't mean they need to get up every hour and do a
Mhm.
30-minute workout,
No, absolutely
right?
not. And that's what people think.
Yeah.
Yeah. So, I mean, small habits compound, right? And small changes can really make a difference. So in terms of the nervous system, if you live in Los Angeles, this is where we're based, try to get outside, get some sunlight, have some time away from the screen. I wear these glasses at work and they're not prescription. People think that they are all the time, but they're blue light protecting.
Oh, I never
So
knew that.
yeah. Yeah. So just practical things like that. Um in terms of trying to turn down the volume of all the stimuli that you might be consuming. And get also maybe make the investment in seeing an occupational therapist, someone who can really talk to you about lifestyle changes, modifying your daily routine. I had really not really a good understanding of what OTs did until I worked with them, and they're outstanding. So
What do they
maybe,
do?
yeah.
Really
So
briefly, I know we're
yeah, yeah,
talking
yeah,
about
yeah, yeah.
physical
No,
therapy,
for
but yeah.
sure. The way that one of my colleagues explained it to me, Leanne Todd, she's great, is she said occupational therapy is anything that occupies your time. So throughout your day, working with daily routines, lifestyle, and then in terms of the actual like physical side of things, if people are recovering from injury, teaching them to put on their clothes again, cook, things like that. But they're really dealing with a lot of lifestyle things that I think that people should be focused on.
Yeah.
Yeah.
Before I wrap up,
Mm.
just wanted to say, we partner together at Ply
Yes.
Physical Therapy, and I've been working with Ply Physical Therapy for well over 10 years, and they're my
Mhm.
preferred provider because they do provide or look to provide the one-on-one care with
Yeah.
clients. We
Yeah, they
have
do.
a certain number of therapists there, and when you come in and meet with your
It's
therapist for
one-on-one
an
the whole time.
evaluation,
Yeah.
one-on-one the whole time,
Mhm.
and you stick with that same therapist,
Yep.
you're not handed off to somebody else,
Yep.
and that level of care, I
Mhm.
haven't been able to. I'm sure it exists, but I haven't
Yeah.
found at other
Yeah.
locations. And I enjoy working with you because I am a certified massage therapist, a certified rolfer,
Yes, yes.
personal trainer, and I love, being able to do the tissue work. But I agree with you. The
Mhm.
movement afterwards is very important. You have to
Mhm.
move.
Mhm.
So I just want to, we've worked a lot with clients. So if you're currently working with a massage therapist and, you want to be able to maybe enhance the benefits that you're getting, working with
Mhm.
a physical therapist along with the massage therapist is
Yes, we're
great.
doing the interdisciplinary
Yeah,
care.
we are.
We
That's
are.
what I wanted to point out.
Yes. No, we are, and that's what I wanted to point out earlier, but I didn't want to speak on it too much. But I love working with you, and honestly, and it's really enhanced my experience at Playa. And I should have kept a like record of the amount of people that we've worked with, but I think it's like well over 10
Yeah.
now,
Yeah.
within a couple of months. So, and they've all have had awesome experiences, but it's because of the collaboration that we do.
Yes.
So that's something that I think is really imperative for me going forward in my career.
Yeah.
So,
Me
yeah.
too.
Aw.
Anything else you want to add?
Um, not really, not at this particular point, but you did ask me a question earlier that I don't think that I fully addressed in terms of what people can do for their bodies and their physical health. And I just want to reemphasize advocating for your health. Sometimes, especially people who are in underserved communities, people who have some medical trauma, you get in situations where you feel like you need to just trust someone because they are your provider. And I'm going to say no, you need to advocate for your health. I tell my patients it's okay to Google and look things up. Some people put people down and say, oh, don't listen to Dr. Google as long as it's not creating fear in their lives. I encourage people to get educated, to figure out what's going on, ask questions, be your own advocate. And then if you feel like you aren't getting the quality of care that you deserve, um, you can always contact me. I'll get you in touch with someone so I can leave my contact information there because I want to make sure that people are getting the care that
Yeah.
they
We'll
need.
be sure to leave it in the show
Thank
notes.
you.
Yeah.
Yeah, thanks for having me.
Absolutely. Thank you so much. Until
Yeah.
next time.
Until next time, hopefully I can come back soon.
Absolutely.
Alrighty.
Thank you,
Thank you.
Adili.
You're welcome. Thank you.
Bye.
All right. Bye.